Okay, well, why don't we go ahead and get started? I want to welcome everyone to the webinar. My name is Claudia Ellison. I'm Program Director here at eHealth Initiative, and our webinar today is Revolutionizing Consumer Engagement in Population Health. We have a really interesting discussion today. We've got, the topic will be how customer relationship management is using technology to improve patient and provider experiences and therefore improve health. Our speakers today are Susan Collins, who's the Vice President of Strategic Partnerships at Salesforce. Susan is a 30-plus-year industry veteran who believes that innovative technologies can reshape healthcare and life sciences by empowering individuals to collaborate and problem solve in new ways. And we also have Ray Hirschman. Ray is Vice President of Population Health Accountable Care Strategy at Cerner. And he has had several previous experiences working for organizations such as Anthem and WebMD. So we've got some real heavy hitters on today's call. Before we get started, though, I'd like to go over a few housekeeping issues. So as all of the participants are muted, if you have any technical difficulties, please use the chat box. We have a chat box and we have a Q&A box. And so for anything technical, please use the chat box. The questions in the Q&A, what happens is if we ever run over time and you've submitted some questions, this saves the questions and then we'll be able to respond to you even after the webinar has concluded. And all of our slides are available on the eHigh resource page. So our mission at eHealth Initiative is to serve as the industry leader convening executives from all kinds of health information technology stakeholders, from providers, payers, vendors, government organizations, et cetera, to really convene and roll up our sleeves to understand the different barriers and challenges and best practices as we look at transforming healthcare. As you can see on this slide, the different kinds of organizations and companies that are part of the eHigh membership family. Currently, we're conducting a couple of different eHigh work groups for our members, value and reimbursement, technology and analytics, and workflow for providers and patients. With each of these work groups, we create best practices, and we are providing these best practices not only to our eHigh members, but we're submitting them onto our eHigh resource page and sending them out to our greater eHigh listserv. So watch out for those best practices. And this is information about our resource page. So if you haven't seen it beforehand, take a look after the webinar and see if there's information. Even if you have some best practices that you would like to share, let us know. As with all of our programs here at eHigh, we're especially grateful for the support that companies such as Cerner provide to these educational programming. And on that note, we will begin the content of our program with our speakers. Ray and Susan, can you please tell the audience about, and we'll start with Susan, about your role and background in healthcare.
Sure. Thanks so much for having me. Great conversation today. Currently, I have the privilege of leading Salesforce's technology partnerships for healthcare. And you may have heard, this is a huge area of focus for our company, an area where we've seen some real innovation as healthcare is transforming to become more patient-centric. It's a very exciting time to be in this space. Prior to joining Salesforce, I was the CEO of a provider organization that is now part of Emory Healthcare. Before that, I was a CMO and Chief Client Experience Officer within the Yale New Haven system. And before that, I spent a couple of decades working on early medical record systems, practice management, revenue cycle management products, as well as little light medical device development. So I've had the luxury to see the industry from several different points of view. Really happy to be with you today.
Thanks, Susan. Ray?
Good afternoon, and thanks everybody for the opportunity. At Cerner, my responsibilities are to help the organization with our strategies around our software and services to help our clients, health systems that have their own insurance companies and other plan sponsors to improve the health and the health status and the overall experience that they provide to their patients and consumers. By way of background, I have a medical economics background. I worked for the first part of my career in provider-sponsored health plans, health systems that have their own health insurance companies. And then the second chapter has been primarily focused on consumer-driven healthcare and provider performance analytics at Mercer Consulting, and then at WebMD. And then the last chapter that I'm in right now is I spent some time at Anthem doing some information management and analytics, and then was at Geisinger Health System and a spin-off they had called XG Health Solutions to help providers transform the way they deliver care and improve population health. And so at Cerner, I work on internal strategies as well as partnerships, such as the one we have with Salesforce.
Thanks, Ray. So, Ray, can you talk about current healthcare challenges and why consumer engagement is such an important initiative?
Sure. So there are a number of vectors driving this. Part of it is really just brass tacks business and the changing way that providers are being compensated. So one major driver is the move or the transition from volume to value-based reimbursement models and value-based care, and it's driving the providers to focus much more on outcomes and the actual health status, total cost of care, clinical quality, patient experience, those type of measures. And in order to drive those results upward, you need to have more active engagement and participation of the patient. The next is it's hard to get patients, whether they're active consumers, passive consumers, avoiders, cynics, whatever their behavior is. It's really hard to drive patient adherence. It's a big deal. It's hard, and the technologies and the whole idea of patient experience, is contingent on the level of engagement that you could achieve between providers and their patients, and so adherence is a tough thing, and so there's a big drive now to see if we can use these new technologies to drive better patient adherence and engagement. And I think the last one, which Susan will touch on some, is it's just the overall expectation of consumers now in every other part of their life, whether it's banking or retail or hospitality. The experience is personalized, it's specific, it's targeted, it's timely, and healthcare has been late to that game. And so I think just the overall expectations of consumers are to have a much better level of engagement and experience, because that's what they're getting for the rest of their lives.
Thanks, Ray. So Susan, how does consumer engagement technologies and CRM systems help to enhance the consumer engagement initiative?
Sure. I think, first it might be useful to kind of share a little bit of a definition of customer relationship management in healthcare. This is a concept that many people historically associate with a sales process. But the heart of things, it really is about deeply understanding a stakeholder that you want to serve in a very holistic way. And in healthcare, we know that clinical information is obviously critical, but it's also only part of the story. We don't ever deal with injuries or disease in isolation. We deal with that rather in the context of the rest of our lives. And CRM technology is the way that most industries are able to synthesize a lot of information about us, about their customers, to better understand our needs, to better understand our goals, and thus be able to serve us in a more personalized way. This is likewise equally meaningful when it comes to understanding patients as human beings. And as Ray noted, this is an expectation now in the market that patients are measuring us as consumers, right, compared to the knowledge and the ability that other industries have to serve them in a very individualized manner.
Thanks, Susan. So, let's continue, Susan, with you. How does CRM contribute to better patient outcomes?
Sure. And so these days, I think we'd all agree that we have a better understanding around the importance of social determinants, for example, and what a huge bearing that that they have on outcomes as well as on patient satisfaction, and therefore, unsurprisingly, also on costs. So a patient who might be struggling to keep a roof over their head, for example, might also be struggling to manage their diabetes, not because they don't understand the value of their insulin therapy, but because they simply can't afford that medication and also meet their family's needs at the same time. And traditionally, that information might or might not have come out of a conversation with a provider. These days, we know providers are very, very pressed for time. There are a lot of burdens already from a clinical perspective that are placed on them. But perhaps, let's say they would have that conversation and maybe even be able to connect that patient to a social service organization. But that's typically as far as we were able to go. It was not an ongoing collaboration around that patient's situation. Now that we have CRM in the healthcare environment, we're able to include those other service providers in the ongoing treatment and collaboration that we have with that patient and their family to better serve that patient, to ensure that they have an optimal outcome and that we wrap them with all the appropriate services that they require to maintain their health.
Thanks, Susan. Hey, Ray, what do you think are some of the key considerations for organizations that want to take on a consumer engagement journey?
Well, there's a enterprise view that's really important as organizations are starting to think about how to do this at scale across their entire clinical enterprise. There's a fair number of different stakeholders within the organization that are responsible for different departments, different functions, that all could benefit greatly from integrating CRM technologies into their part of the business. And as opposed to starting out with a point solution that's only in one department and then trying to grow from there, many organizations are beginning to recognize that if they step back and begin to think through this from an enterprise perspective, a system-wide or a organization-wide view, the way you think about designing and developing and implementing these solutions will take a different form. This is by the way a marathon. This isn't a quick type of strategy. These things take a fair amount of time and a fair amount of infrastructure to be able to realize the full potential of CRM capabilities. One, enterprise view. Two, it just inherently is multi-stakeholder. A lot of organizations start from the marketing department. Some are starting from the care management area, clinical setting. Some are thinking through from their social services and community outreach perspective or in revenue cycle. A number are looking at it starting from their inbound call center patient access perspective. And each one of these areas is a very important part of the overall system. But when you think about how to design and implement CRM technologies on an enterprise basis, it becomes multi-stakeholder. And so there has to be, a process of making sure we're dealing with both inbound and outbound interactions. And another key part of the architecture is to really think about all the different channels in which health systems are interacting with their patients and providers, for that matter. It's phone, face-to-face, video is increasing, mobile, portal, text. All these different channels are part of what need to get incorporated into the overall CRM strategy, so that regardless of what channel you're interacting with that consumer, that patient, that the information is consistent, it's harmonized, it's orchestrated. And so there's a fair amount of strategy that comes into play when you go about this journey. Doesn't mean you can't start and get some quick wins along the way, but as organizations are thinking about how to go about this, for the long term, that it's that enterprise perspective that is becoming much more predominant. And because it's enterprise, it requires things like governance and enterprise data. There's a whole bunch of other factors that come into it. So most often what we're seeing is the marketing area or the head of digital experience or somebody who's head of population health management becomes a champion, but they quickly realize that they got to pull in other parts of the organization to be part of the discussion about how to roll this out on an enterprise-wide basis.
Ray, can you just talk a little bit about the clinical operations efficiencies and how you see it impacting workflow? We hear a lot about the challenges with workflow.
Sure. So there's a couple key things right now in relative terms, right? The vast majority of how health systems interact with their patients, it's either a face-to-face visit, and then there's a gap, there's a duration of time between, or there may be a phone call. Somebody may or may not go to the portal, but it's the design of that experience or that engagement is very episodic. And with CRM technology, integrating it with your other communication channels, you could start thinking about how to interact with people on a much more frequent, targeted basis, a more personalized basis, and oftentimes that also changes how people do their job, whether it's the inbound call center and rethinking what that interaction looks like and feels like, not only from the consumer perspective but also from the agent on the phone. What's their scope of responsibility in the clinical side. Going back to that patient adherence and compliance side, using these technologies, it's much easier to begin to interact with your panel of patients. And if they're falling off the wagon, if they're not compliant, if they're not getting their drugs filled, if they need to get follow-up visit, or they haven't had their annual wellness exam or whatever, the technology can be used to increase the frequency and the nature of the interaction, and it has material impact on clinical workflow, but it also improves the overall, health status and the quality of the care that people can receive.
Thank you. So the relationship between Cerner and Salesforce is really interesting. And it's interesting how some of these, standard healthcare companies are really expanding the products and services within the healthcare arena. I'd really like to understand how you all started your collaboration.
Yeah, I think this was very much kind of a natural marriage, I would say. Cerner has been an industry leader for as long as I can remember, for sure. Healthy Intent, their population big data platform, is highly regarded. And then I think, through that amazing technology, we have tremendous insight now around what we can do for patients and their families, as well as better informing the providers. And I think it would be a mistake to leave provider satisfaction out of this relationship equation. We're super excited to partner to support an enhanced consumer and provider engagement solution, and to deliver in a very practical way, I think, on the promise of true population health management with all of, all that implies. We can leverage both of our industry leading capabilities to do that in a very intelligent and proactive way. And this, I think Ray touched on something really important when he focused on the nature of the relationship between providers and patients having historically been quite transactional, which is suboptimal. Let's agree, when you're talking about a relationship. A relationship, by definition, is something that's ongoing and collaborative. And I think our ability to bring that to some reality in healthcare is super, super exciting.
Yeah, and Cerner was initially looking at CRM capabilities to provide additional services to our clients, supporting them in analytics as a service, care management services. And it just became apparent that, one, the complementarity between what Salesforce's capabilities are and what Cerner had been building with Healthy Intent were really powerful together. It's chocolate and peanut butter, or whatever combination. Right.
My favorite.
Right. So that's good. It's that time of year too. And I think the second is that, once folks start understanding the power of CRM capabilities, then you realize that, what you need to put, the gas that you put in that tank is the data the related content that moves through those pipes. And so, you know, that's kind of Cerner's sweet spot, and we really didn't have the competencies or the level of investment to build CRM technology. You know, it was considered, but, you know, to partner with the best in market on the CRM side, not only did it accelerate us, but it allows us to focus on what we're good at and to partner on the parts of the technology value chain that, you know, we don't have strength in, that Salesforce is you know, market leader in.
Well, it's a great combination, and I like your analogy with the peanut butter cups too. It works. So Ray, how do other consumer engagement technologies, you know, like the patient portal or virtual health capabilities, work with the CRM technology to further enhance the consumer experience and better increase, you know, patient engagement?
Yeah. So think about, you know, all the different channels. You know, you could call them channels or modalities, whatever term you want to use. But, you know, folks are moving more from phone and snail mail and, you know, and a portal, which is, you know, an important front door, but it's, you know, it's really hard to get people not only to register, but then to keep going back to the portal as their primary, you know, interface. You know, it's mostly their phone now, right? You know, it's an app, it's mobile. If it's synchronous, real time, or asynchronous, they don't need it right away, but they just want to interact and find something out. And we're seeing other new modalities, you know, get introduced as well. Videos becoming more predominant as a mode of interaction. Virtual assistants, you know, that's coming along pretty fast. I still think there's a little bit of time here to hone using virtual assistants and bots for healthcare, but that's coming on fast, and that's a different kind of interface for people to use. But the bottom line is that if you're thinking about it as whole person, Ray, over time, and I may interact through multiple channels, I also may have a preferred channel, a preference of one way versus another that may vary based on my profile versus somebody else's. And so regardless of channel, what you want to be able to do is facilitate that bi-directional interaction, inbound, outbound, and it could be one time, but it also, what people are thinking about is how do you string together and choreograph a journey or a process, and to use CRM technology to help people through that process. It could be managing a chronic condition over a long period of time. It could be something episodic, a hip replacement where there's a beginning and an end, and there's a number of interactions that happen throughout that episode of care. And so, you know, the key here is as you're thinking about your strategies, how do you plug in these different modalities into the CRM framework to drive, you know, optimal, again, experience trails engagement. You get engagement, you will get good experience. And so I think that's the upside, is it's the nature and the frequency of the interactions can be heightened. The downside or the risk, we'll come back to this, is if you don't think about this at a system level and the choreography of all this, you could inadvertently, you know, spam people and just kind of overwhelm them with over messaging, which it actually has a worse consequence because people shut down. So, you know, I think we're nascent in this process, and folks are thinking through how to orchestrate and you know, harmonize the different messaging that's going out from the clinical enterprise to the consumer.
Thank you. Susan, so the discussion about how you form the relationship has been really interesting. Now I would love to hear about an actual use case. Can you walk us through an example of a consumer experience?
Absolutely. So what you see on your screen are a couple of use cases where CRM can make a pretty significant difference today. I think today we're going to take a look at that rising risk population, which is of interest to a lot of provider organizations or payvider organizations, because these are the folks that we can impact in a proactive way to keep them healthier, to have better experiences, to not need expensive ongoing care that is avoidable. And so why don't we take a look at Maria's situation? I think that would be on the next, our next visual. So here's Maria. Like a lot of us, very busy professional and personal life. She puts her family first, like many of us do. And so, you know, her health needs exist for her as one of many priorities. But she has been diagnosed with type 2 diabetes, which can be a very serious condition. And, it has to be managed in the context of the rest of her life. So we know a little bit about her. We know that she prefers to hear from us via email. We know that she is not a particularly active member of our patient portal, which is, unfortunately pretty typical of many of our consumers when they're not in acute situations. She's got a lot going on. She's got a very active family. She's got, husband to take care of. She's got her kids have kids now, right? It's like a lot of our situations. So let's take a look at how we would kind of see her from a technology point of view. So we think about looking at cohorts of patients when we think about them in a population health management context. This is the Cerner Healthy Intent product, and we can see all kinds of measures that we might be interested in when it comes to managing a particular cohort. And in honor of October being Breast Cancer Awareness Month, today we're going to focus on the need for certain folks to have breast cancer screening. And Maria is one of those folks who has let that slip, and we know that that's quite common. So we're going to take a look at how we might build a journey for Maria and folks like her to encourage her to have that screening exam. And the way we do this is through using a Salesforce technology called Marketing Cloud. And what we'll see in the next visual is that there is kind of an easy way to build different paths depending on how Maria engages or doesn't engage with us. This is a very routine function in pretty much every other industry that you could think of. If you buy a product and then don't activate it, for example, there will be lots of technology behind the scenes saying, do we send you a text? Do we send you an email? Do we send you another offer, et cetera? And we can leverage that technology in healthcare as well. So in this case, we've identified that there's a gap in care here. This is someone who would benefit from a screening mammogram, and we're going to accommodate her preference for email and send her an email invitation. We have a campaign built by our crack marketing team to encourage her to have this screening. And then we have a number of different paths that we can go down depending on whether she opens the email and acts on it or not. Let's take a look at what that looks like from Maria's perspective, right? We know that everybody lives on their phone today. And so here's what Maria's email invitation might look like. And that's, I think pretty compelling. Lots of people hear this time of year, particularly about the need for breast cancer screening. And in this case, Maria's like, yeah, I really need to do that. I need to get that taken care of. She's not pushing the button to schedule the exam yet. So instead, she's going to make a phone call, see what the options are, see if this can be done within the context of her busy life. And so we'll take a look at what happens when she makes that phone call from the perspective of the person receiving that call. So now you imagine that you might be in a call center, in a provider environment. And what typically happens historically is you take the call and it's completely blind. Somebody has to explain who they are, even if they've been a real frequent flyer at your facility. It can be quite difficult to pinpoint the reason for the call, and this is not a great personalized experience for your patient. But in this case, we have great telephony integration, so we know that when Maria calls, we know who she is. You'll see on that left-hand panel that we have a pretty decent amount of information about her. From a health perspective, we know that she has diabetes. We know what her motivations are and that kind of thing. We could have other information like allergies, for example, those kinds of things. And then we have in that middle pane is a bit more about the engagement. You'll see the conversation tab. You'll see the longitudinal record tab. This is where we're pulling in a lot of rich data from multiple systems, including Healthy Intent, which is aggregating information from multiple sources so that we get a really quick snapshot of what this person's health situation is. And then today, of course, we're talking about getting her involved in a breast cancer screening event. And as somebody who used to manage patient contact centers, I can tell you this is huge. We used to get calls all the time from people saying, hey, I got this flyer from you about the event on Saturday. And the poor person receiving the call on the agent side of the desk is thinking, what flyer? What are you talking about? And you don't want to say that to the patient. You want to say, oh, that's great. Let me help you with that. In this case, we know that Maria's been invited to this breast cancer screening. We see that in that right-hand section of the screen. So we know exactly what she's referring to. And we can literally walk her step by step through the process of getting that appointment. We can give her all the information that she requires. We can send her additional information if that's needed. We can send appointment confirmations and the like, all from a single pane of glass. And then you'll see right below that, which is also quite new and rather innovative and leveraging the technology as it's used in other industries, that section called Next Best Action. So while we have Maria on the phone, this is where we can do some relationship building and say, geez, by the way, Maria, we noticed that you haven't signed up for our patient portal. Let me tell you, if you have a minute, a little bit about that and why this would benefit you and so on. We can surface other gaps in care. You could imagine any number of scenarios where that might be the most effective next step. And this is where we start building a very personalized interaction with Maria that's very tailored to her specific situation and her needs. So then we'll see it again from Maria's perspective. She decides that the patient portal sounds pretty interesting. She'd like to sign up for that, and we can walk her through that process. And then we can send her a confirmation, again, right to her phone. And I think, yeah, there we go. That's how it might look to Maria or to another consumer. And you'll notice in the bottom, we have a little button that says, how did we do? So when you think about building patient satisfaction, gathering data, and creating a learning system that is getting better and better and better every single day, the ability to reach out to that consumer and say, did we meet your needs today? Was there anything else that we could do to assist you? These are all very powerful technologies that other industries have leveraged for literally for years that healthcare can benefit from. So the good news is Maria was very satisfied and actually has started to use the portal technology, and she can receive results. She can interact with others in a social community, if you want to think about almost a Facebook-like experience, but very tailored to someone's individual health requirements and situations. We can actually embed that experience in the portal. And of course, we're talking about breast cancer here, so you'll see that the information that's presented upon login when Maria hits that portal is very, very much tailored to her current situation and wanting to know more about breast cancer. This could be just as easily information for new moms, perhaps, or any other condition that you might think of. And this is all building another very rich profile for this consumer that will continue to inform that relationship over time. And of course, from a management perspective, this is also a beautiful way to gather additional data. All these interactions are captured within the technology so that we get beautiful dashboards to easily understand what we're doing well at, what areas of the business require perhaps some improvement, and frankly, to understand the return on investment, for example, from a breast cancer marketing campaign. So I think we have a visual following this that would help someone who is managing a contact center understand the health of that business, where some additional training might be required or useful, and also be able to support additional opportunities going forward to do more outreach to the community.
Ray, did you have any comments about that particular dashboard?
Sure. So I think there's two levels of measurement here, and one is the activity, the productivity of the call center, of the impact and the answer in the first call, resolution, all the type of kind of what I would say is kind of your productivity type of reporting specific to that call center function. But the way we've designed the system with Salesforce is this interaction data that's represented in this dashboard also flows back through into healthy intent. And again, this was driven off of identifying that Maria had a gap in her care. And, in this case, it was a breast screening, but it could have been that she hadn't had a PCP visit in 2 years, or that there wasn't follow-up on a drug. I mean, just, the number of different examples is, infinite. And so by bringing the interaction history back into healthy intent, we could not only do outcome measurement on the whether the call was a good experience and did it resolve the issues that individual was calling about, but we could tie it back to the quality of the provider organization over time. Are they improving the overall clinical quality and the closing of gaps in care? Are they improving their measures, whether it's their star ratings, tied to Medicare Advantage, or for their Medicare Shared Savings Program, all the different reimbursement models, again, track back to these performance measures. And so you could go from an N01 Maria to thinking about how you develop campaigns and targeting and segmentation strategies to begin to do this at scale in a systematic way. And by bringing that interaction history back into healthy intent, you have a way to do outcomes analysis. And so that's another dimension that is an add-on to this view that's pretty powerful. And that's another form of ROI. What's the long-term impact on either patient health status or on how providers are doing, in their value-based reimbursement arrangements?
I was wondering, how long have you been working together on this particular project?
We started in September 2 years ago talking, and we're both pretty large organizations, so we did a lot of talking. And then about a year ago, we really started turning the corner and beginning, our not just the contracting part of the partnership, but really the strategy and the design, and thinking through really, how do we build this integrated solution in a manner that really is not only differentiated, but again, goes back to how would we build this, not only so it's repeatable for client to client, but also how do we make sure that the bi-directional flow of data between our two systems actually operates, so that we could actually deliver the experience that Susan just walked you all through.
I mean, it's fascinating, and the visuals are just fantastic. And I look forward to here at EHI to learn about success stories with this, because I think that the more we can engage patients, it's just been shown over and over, it really does improve care. We've got several questions, but I want to start off. I'll start the questions here. For both Susan and Ray, what is the one key element that you learned over the process that you can share with the participants on the call for organizations who are looking to start a consumer engagement strategy?
Yeah, that's a good question. I think every organization is likely to have different factors, right, to consider. As Ray mentioned at the top of our program, you might have perhaps an initiative around a contact center transformation. That's a wonderful place to start. You might also have value-based contracts that drive a different point of entry. I think the most critical thing, though, is to echo Ray's earlier comment about this being a real enterprise strategy and not something that is solved with a point solution. This is something that requires organizational acceptance and support across the entire spectrum of the business to do really well. And I would encourage people not to think of this as simply a marketing initiative, for example, but rather to think about this as a core component of the business.
Ray,
I think that, I'd echo what Susan said, and I think another one is kind of with the end in mind. You got to start, and I think we have a fair amount of activity with people that they've already started, but they kind of got themselves boxed in because they started with a point solution, so they're thinking about how to work their way out of that. Others haven't started at all, and they're trying to figure out where to get going. And what I would suggest is you work out your strategy, but you get into execution mode. You just learn so much once you get going. One is you end up going faster than you think you can, and two is as soon as people are starting to get traction, they're wanting to extend it out to the rest of the organization quicker than they had anticipated, just because they see the power of what's possible. And so, I think while this is a bit nascent, we're still developing a lot of this. What we're seeing is just, a lot of folks recognizing that, while this is a marathon, that, you got to start. And so that's what's exciting is we're seeing a lot of traction from organizations starting from different points within their organization, but they seem to have a common end in mind of how to take this to scale across their enterprise.
Thanks, Ray. So let's go ahead and get started with the participant questions here. The first one is, how can this platform and solution be embedded into smaller, underserved community organizations to empower them to capture SDOH and other data?
Yeah, so I think that's the beautiful thing about this type of technology is it's quite scalable, right? When you talk about cloud-based software, particularly this software as a service model, because it's not as historically we had to do, right? You don't have to stand up a huge infrastructure to deliver this. This is something that's delivered as a service that scales quite neatly, whether it's a small organization or quite a large one.
Yeah, and there's parts of what Salesforce has that provide extensibility, and it could be for a very targeted, use case. So say it's a food bank that, and you want to facilitate people's access to better diet, or it's to work with the YMCA, who happens to have one of the best disease management programs in the country, but you don't think of that as a normal spot, and you're saying, well, how do you make it extensible to them? And you wouldn't turn the entire system onto them, but you can extend out, the framework or a microsite, if you will, to bring them into the fold and bring in community services into the care team, if you will, and have that be managed across the continuum.
That's a good point, right? And that's actually fairly typical. We see programs like the one that Mount Sinai runs around their disparate patient population, where just kind of almost by definition, these are patients who have very, very significant social and economic challenges, a lot of times in addition to typically multiple chronic conditions. And the ability to collaborate with social service agencies, with charitable organizations, with religious organizations that are providing support in the community, and not only connect the patients and their families to those services, but also reflect back an ongoing stream of data from those organizations back to the clinicians who are serving those patients, provides a very, very different experience than what those patients have had historically, and just driving amazing outcomes.
Okay, thank you. Okay, the next question is that companies like Amazon, Google, and Facebook know far more about us than healthcare organizations do. Our payers, providers. How does the healthcare industry fill this huge knowledge and data gap so they can improve the impact they have on individuals' health?
Susan, let's share this one, because
Sure.
I think there's two halves of it. So yeah. One is, Cerner, obviously we, with Healthy Intent, we pretty much, we're black belts in synthesizing all the different, electronic medical record data, insurance administrative data, a fair amount of self-reported data, mostly around patient-reported outcome measurements and risk assessment, this type of stuff. We also have a lot of new data capture around social determinants information that's self-reported, within the clinical workflow, registration, care management processes. So we bring a fair payload of high value data, but there's the rest of what somebody's about, what, their preferences, like you said, some of their behaviors that are tied back to their purchasing patterns, and a lot of that data also has, incredible predictive value to that as well. And those are things that, aren't in Cerner's wheelhouse that Salesforce does work, to incorporate into the profile. So we're leaning on Salesforce and how they do that for other businesses, as opposed to us trying to figure that out.
Yeah, and I think, this is where healthcare can take a bit of a page from other industries' playbooks. When you think about the way we interact with some of these other firms, whether it's Amazon or Google or Facebook or any other kind of consumer-focused entity, if you think about the reason that they gather so much data is that we interact with them very, very frequently and in a lot of different contexts. So when we talk about having a true 360-degree view or understanding of somebody in a very personalized manner, they're quite good at that. And that's because they don't typically view the situation as a transactional or episodic one, but rather they are very, very disciplined about viewing that as a relationship. And that's obviously what CRM was designed to support.
And we do, and we are experimenting with clients with bringing in third-party marketing data sets and different behavior models. There's a number of really good models that help classify people into different segments, market segments. But it's really, the extension really goes more into where Salesforce has been living for a long time and is relatively new for healthcare.
Thank you. Okay, so another question. How can CRM technologies help with severe chronic diseases to improve quality of life?
Okay, so this one is easy to say, hard to do, right? So
Yeah.
when you talk about chronic conditions, there's some people that they're so on top of it and so well managed that it's more just keeping some surveillance going, because there might be a blip or somebody falling off the wagon or something else going on, another condition that pops up that creates a flare up. Then there's people that are, they're pretty good at managing, but sometimes, you'll start to see, lack of compliance with drugs or increased frequency of going to the ER or whatever. And then there's the really tough cases where, oftentimes it isn't just one chronic disease, but people are comorbid. And for each one of those three different kind of, segments of people with chronic conditions, you want to alter and think through, what's the frequency, what's the nature. And while CRM technology could accommodate or facilitate some of the messaging and the automation, it also says for that really tough cohort, those really hard to manage, we're going to go with much heavier touch, much more labor intensive type of model. And so part of that is you want to build a really important relationship so that the people trust and will build that long-term relationship. And if it's the care manager and individual, that's great. But a lot of times it's a care management team. There's different players. There's the social worker. There's the nurse. There could be the Meals on Wheels, whatever it is that else is supporting that individual. And so in that slice, that really hard to manage, I think, the CRM capabilities are an additional element that you could bring to the table, but I don't think it's ever going to be a substitute for the face-to-face and that personal kind of real-time interaction that people will meet.
I agree, and I think there's an important element of being able to identify the appropriate calibration of resources for these populations. It just simply doesn't work and is not supportable typically from an economic perspective to treat everyone with disease X in the same fashion. And the way that historically we've had to manage those patients is we develop some program and we do typically treat them in somewhat of a generic fashion until something goes pear-shaped, in which case, we fire up the teams and wrap additional services around that patient usually. But that's a very reactive model. What we're looking to do is to create a much more proactive approach to identify a very tailored and unique approach at scale for these patient cohorts so that we know who is most likely to require that intensive support and make sure that we measure and provide that and track it. And then there's an entire percentage of that population who are just fine, managing it with an app or some lighter support. And being able to deploy those resources appropriately is really important.
Yeah, I have one quick add-on here in that, historically, just because it has been more labor-intensive to try to take care of these chronic tough cases, the organizations focused on that 2%, 3%, and the other 97%, are not getting the level of activity or engagement. And with technology, you could not only get to the 100% interacting with 100% of the population, but the other is it's not the same 2% every year. There's flux in that population, and so by having that other 98% engaged in a consistent way over time, when they do end up moving up to that top 2% or 3%, one, you'll know about it sooner. You can mitigate it, get moving to high risk. But the other is that you'll have already had a well-established relationship, so you're not starting from scratch. You just increase the intensity and change the form of that engagement as opposed to saying we're starting from scratch.
That's a good point.
Thanks, Ray. So another question is, how can patient segmentation information be integrated into a healthcare provider's call center workflow?
Yes, so we saw a little bit. We saw a little bit of a sample of what that might look like in a call center environment a few minutes ago. But typically, this is the value of providing that single pane of glass that aggregates all of this different information in an appropriate way based on the person who's taking a look at that screen. Right? We know that we need permission-based systems to surface appropriate information in the proper context of the job that's being performed. So Salesforce has, from the very beginning, been a very open system, very API-driven. We follow the FHIR standard. So from a technical perspective, this is quite a straightforward process. From a change management perspective, once people see that they don't have the swivel chair problem and having to look in multiple systems or phone a friend to get information in that call center environment, which is typically quite a high volume, somewhat high pressure environment, it's very well accepted.
Yeah, and the segmentation could, it could be very broad. It could be very targeted as well. The underlying data will, assist in how you want to define that segment. But are these frequent flyers? Are these people that are totally net new to the delivery system? Are they people that actually the care management department has been trying to outreach to them for 3 months, and now you got an inbound call coming in, and you want to vector that to the right hunt group or agent set that is more skilled in handling that type of case? So I think the segmentation part of this allows you to, instead of having a real general kind of on average call center, you can begin to not only segment the population you're taking care of, but you can segment the workforce to accommodate or support different segments of the patient population.
Thank you. Okay, so what types of data sources can be incorporated and how often is the data updated?
All right, so I'll start and Susan will go, but from the clinical data side, within Healthy Intent, the data is, some of that data is near real time. So the clinical data from the EMR gets updated pretty rapidly. Some of the administrative or insurance data is more batch in orientation, daily, weekly type of updates. Some of it could be more frequent. If it's coming from a reference lab or a PBM, we get that data more frequent. And then obviously the interaction data that's happening through Salesforce comes back in near real time. We're pushing data up into Salesforce to have that system primed and loaded with key data so that the service layer, the health cloud layer can operate. But then I think I'll hand it to Susan, where if the client wants to add, people that are new to the area moving in, or if they bought a new practice, they bought a new orthopedic practice and they want to rebrand and outreach to a patient base that hadn't historically been their clients. There's a whole set of work streams that are much better accommodated within Salesforce than within Healthy Intent.
Sure. Thanks, Ray. I think the only, you described it beautifully. The only additional observation that I would make is that the data is not typically the challenge in healthcare. We're sort of awash in data. It's the ability to take that data and synthesize it and derive some insight, and then critically traverse that last mile to make that insight actionable for an individual at the point of care that is really meaningful. And I think that's one of the things I'm proudest of when I look at this joint solution, is our ability to deliver that in pretty near real time based on the situation that a patient or their family might be in, and to arm a provider, frankly, with the best possible, most complete picture of that patient that's available.
Okay, so what specific data do you feel is most important to collect, and how does this change by type of organization?
Wow, most important data.
All of it, right?
Yeah, it's all pretty important. Your phone number is pretty important, because if you know the phone number, you can get to their iPhone.
Right. That's right.
I would say there's categories of data that I prioritize. Obviously, from at the Cerner vantage point, we put high value on that clinical and administrative data to understand, what's the quality and the completeness of the care. But I think as important are our people's preferences. Social determinants data is really rich, and it's I think there's ways to collect that are moving pretty quickly. That's very important. In many respects, that social determinants data has better predictive value than the actual clinical and administrative data. So it's hard to say that one data set is the most important. I think what I would advise to you all is take stock of what your data assets are today and leverage the heck out of them, and then understand the gaps and fill them. And like Susan said, most folks have a ton of data. If it's in a container like Healthy Intent, it's pretty ready to use. Some organizations, they have silos and stovepipes of data all over the place. And so, as you're thinking about going through this, you do want to have the enterprise leveraging a common data set, whether it's the patient data or the provider data. You do want consistency across the enterprise from a data perspective.
Thanks, Ray. So I think we have time for just one more question, but for all the questions that we didn't have time to respond to, Ray and Susan, we can talk offline and respond to those questions after the webinar. So the last question is, can this platform pull and aggregate data from different types of provider organizations that are potentially using different EMRs, but all collaborating on health outcomes of a specific defined population?
Yeah, absolutely.
So that's, Susan, I'll just go real quick and say that's exactly what Healthy Intent is for. It's a EMR agnostic solution. So while it receives data from Cerner's electronic record Millennium, it's been designed specifically to be agnostic. So we're getting data from just about every electronic medical record on God's green earth. We pipe that data in. Obviously it's client by client, but I think Susan on the Salesforce side, the extensibility into the rest of the workflow, the call centers and everything is again another another aspect beyond just the clinical data that you need to consider.
Yeah, agreed. I think, the thing to think about when you look at a technology like this is we have systems of record, right? Medical record systems, et cetera, claim systems. And then you have engagement technologies. And what we're talking about is a layer of engagement that sits across multiple systems of record typically. And that's where that aggregation and that insight is coming from. And that provides a nice single source of truth, if you like, across multiple different environments typically.
Well, this has been really such an interesting discussion. I want to thank Susan and Ray. I also want to thank Cerner again for their support of this webinar. But before we sign off, Susan and Ray, any last comments or recommendations?
I think if you haven't already, we have lots of material available that does a little bit of a deeper dive in all the different areas that we've talked about today. And we're certainly happy to provide additional support around conversations you might be having in your organization.
No, thank you, everybody. Thank you, everybody, for your time. Yeah, if you're interested,
appreciate it.
Give us a call.
Well, great. Well, listen, thank you again, everyone. Thank you to our presenters and Cerner, and also to all the attendees of the webinar. And I wish you a good rest of your afternoon.